December 23rd, 11 p.m. A 45-year-old man arrived at the ER with severe chest pain, sweating, pale, clutching his chest. Acute heart attack. I was on call. It was Christmas Eve and the hospital was relatively quiet. Most real emergencies come after Christmas dinner. This man needed immediate attention. While we connected monitors and prepared medication, Nurse Diana approached and whispered in my ear, "Dr. Michael, that's Roberto Salazar." The name meant nothing at first. She continued, lower, "The serial killer, from the news. They caught him 2 weeks ago." Then I remembered. Roberto Salazar had raped and murdered 6 women over 3 years, young women between 20 and 30. He strangled them after. They'd finally caught him thanks to DNA evidence. He was in police custody awaiting trial. The security guard was outside the room, waiting. I looked at the man on the gurney, sweat running down his face, eyes filled with fear of death, and I had a thought I'll never forget. This monster is afraid of dying like everyone else. But I'm not a judge. I'm a doctor. And I had work to do. I ordered standard protocol for acute infarction, aspirin, nitroglycerin, anticoagulants. And then I administered the morphine injection for pain. I didn't know that decision would haunt me every night for the rest of my life. 10 minutes after administering morphine, Roberto started deteriorating. Blood pressure dropping. Irregular heart rhythm. Then, complete cardiac arrest. The monitor showed flatline. I yelled, "Code blue!" The team ran in. We started CPR immediately. Chest compressions. Defibrillator. 1 shock. Nothing. 2 shocks. Nothing. Intravenous adrenaline. More compressions. 45 minutes we tried bringing him back. But Roberto Salazar didn't return. At 11:47 p.m. I declared his death. The security guard notified authorities. Nurse Diana prepared the body. And I stood there, exhausted, sweating, looking at the corpse of the man who'd killed 6 innocent women. And I felt nothing. Not sadness, not relief, just emptiness. I filled out the death report. Acute myocardial infarction, cardiac arrest, unsuccessful resuscitation. Standard protocol followed. Everything medically correct. But as I wrote, something in the back of my mind whispered a question I didn't want to hear. Did you do everything you should have? I went home that Christmas Eve at 2 a.m. My wife was already asleep. My kids had left milk and cookies for Santa Claus. And I sat in the darkness of the living room, staring at the Christmas tree, knowing a monster had died under my care, and wondering why I couldn't feel anything about it. 3 days later, December 26th, I got a call from Dr. Patricia Mendez, the medical examiner. "Dr. Michael, I need to talk to you about Roberto Salazar." Her voice was serious. I went to her office that afternoon. She had the autopsy report in front of her. "Michael, I found something in toxicology. Roberto Salazar had severe morphine allergy. Allergy documented in medical records from 10 years ago. I felt my stomach drop." "What?" She continued. "The morphine you administered triggered anaphylactic shock. That caused the cardiac arrest. It wasn't just the infarction." I asked, voice shaking, "Would he have survived without the morphine?" She slowly shook her head. "Probably not. The infarction was severe, but morphine significantly accelerated his death. There were alternatives, fentanyl, other analgesics. If you'd checked allergies." She didn't finish the sentence. "Didn't need to. There was clear protocol. Always check allergies before administering medication. But, in the urgency of the moment, with a man in acute infarction, I'd followed standard protocol without verifying complete medical history. Medical error." "Technically," I asked, "does this go into the official report?" She nodded. "I have to report it, Michael. It's procedure." I left her office with trembling legs, and then, the question that had whispered in the back of my mind 3 nights before screamed at full volume. Was it really an error? Or did some dark part of you not want to check allergies when you knew who he was? The hospital opened formal investigation. Attorney Fernando Ruiz from the medical board interrogated me for 2 hours. "Dr. Michael, Why didn't you check allergies before administering morphine? I explained. Cardiac emergency, seconds count, followed standard protocol. He wrote every word. Then he asked something that chilled me. Did you know who the patient was before administering medication? I answered honestly, yes. The nurse told me. His eyes narrowed. And did that influence your decision? I wanted to scream, no, I'm a professional. But the truth is, I didn't know. Would never know. I said, not consciously. That word, consciously, hung in the air like an accusation. The news leaked. Media seized it. Doctor administers fatal dose to serial killer on Christmas Eve. Some headlines called me avenging angel. Others, negligent doctor. My phone wouldn't stop ringing. But what destroyed me was when Ana Gutierrez, mother of Roberto's third victim, showed up at the hospital. She hugged me crying. Thank you, doctor. Thank you for ridding the world of that monster. My daughter can rest now. I tried explaining it was medical error, not justice. But she didn't want to hear it. And when she left, I sat in my office and cried. Because I didn't know if I was crying for having committed medical error that accelerated a patient's death, or if I was crying because secretly, in some dark corner of my soul, I was glad that monster had died under my care. The medical board deliberated 1 week. They suspended me temporarily while investigating. During those days, I lived in torment, couldn't sleep. When I closed my eyes, I saw 2 scenes alternating. Roberto Salazar dying in my emergency room, and the 6 women he'd killed, their photos from newspapers. The verdict came. Medical error for not verifying allergies, but no evidence of malicious intent. 30-day suspension without pay. Upon return, mandatory training in emergency protocols. It was minimal punishment. Some colleagues congratulated me privately. You did right, Michael. That monster deserved to die. Others avoided me in hallways, as if my negligence were contagious. But the worst part was when Dr. Javier Torres, respected cardiologist, told me something I'll never forget. Michael, the problem isn't what you did. It's that you'll never know the truth. And that doubt will eat you alive. Because if it really was an accident, you can forgive yourself. But if some part of you wanted it, then who are you really? He was right. That question haunts me every day. I decided to do something that was maybe masochism or search for redemption. I visited the families of Roberto's 6 victims. I needed to look them in the eyes. Ana Gutierrez, the first who'd hugged me, received me in her home. She showed me photos of her daughter Maria, 23 years old, nursing student, bright smile. He strangled her and threw her away like trash, Ana said. Thank God that monster is dead. And thank you, doctor. I said, ma'am, I didn't kill him intentionally. It was medical error. She looked at me confused. Error or blessing? My daughter rests. The other 5 families rest. Why torture yourself? I visited 4 more families. All thanked me, all called me hero. And each time I tried explaining it was accident, they didn't want to hear. The 6th family, parents of the last victim, were different. The father looked at me with hard eyes and said, Doctor, I wanted that man to suffer in prison his whole life. You gave him easy escape, quick death without justice. So no, I don't thank you. I left that house trembling. Because he was right. Death was escape. And if some dark part of me had allowed that escape, then I'd robbed justice from 6 families. Truth is, I reviewed my notes from that night 1,000 times, reviewed video recordings, searched for evidence it was pure accident, but never found it. Because the evidence I needed was in a place no doctor, no judge, no investigator can reach, inside my own subconscious mind. Today, 1 year later, I returned to work. I'm still Dr. Michael, still saving lives. But every time I administer medication, I check allergies 3 times, 4 times, 5. My hands shake a little more than they used to. People ask if I think I did something wrong that Christmas Eve. And the truth is, I don't know. Legally, I committed minor medical error. Morally, the answer depends on something I'll never know. Did I want that man to die? I've talked to psychologists, to priests, to colleagues. They all tell me the same. Forgive yourself. It was honest error in moment of emergency. But the truth is more complicated. Because I'm human. And when I learned the patient was a monster who'd killed 6 women, did something in me relax a little? Did I check protocols less carefully? I'll never know. And I've learned to live in that gray zone, that space between angel and demon where we all really live. I'm Dr. Michael. That Christmas Eve, I learned that humans aren't purely good or purely evil. We're complex creatures with light and darkness constantly fighting inside us. And sometimes, the line between error and intention is so thin that not even we ourselves can see it. If this story disturbed you, it's because it touched something true. Subscribe, because every week I share cases that remind me that medicine and life isn't black and white. It's 1,000 shades of gray. And learning to live with that ambiguity is what makes us human.